We are back on Morning Line. Our final segment this morning with Clint Kelly, malpractice attorney. It's always good to have him on education whenever he does come on. We can take some calls, 737-7587. I want to ask you real quick. I don't know if this is outside your realm, but 60 Minutes had another program this weekend, and they interviewed the attorney who's about to go full bore against the opioid pharmacies. Yeah. The companies, not the pharmacies, pharmaceutical companies. He's the same one that was behind the BP oil spill settlement. He's the same one that got big tobacco. And this guy knows what he's doing. And he's going after the pharmaceuticals. His office is in Grayton Beach, Florida.
Is it Papantonio?
No. Now, he may be part of that with him. Yeah. There's several lawyers involved. The guy's name escapes me, but he's right there and on vacation spot. A lot of us know where that is, the Red Bar, Grayton Beach.
There are a bunch of these lawsuits pending right now, Nick. I mean,
yeah.
I don't know if he may be
He's kind of heading it up with the states involved and consolidating and going after it. And I'm just wondering your thought on it in terms of the overprescription of opioids and whether that can ever, if the doctor's involved, cross over into the realm of malpractice or not.
It can. Let me tell you why I think this is going to be different from big tobacco. On the one hand, I do believe these manufacturers are going to pay significant dollars, okay, because they do have a hand in contributing to this epidemic. The difference here is you have what we call the learned intermediary doctrine, which is the fact that the doctor makes the decision whether to prescribe, and the manufacturer can rely on that doctor's skill and training to make that decision. The manufacturer doesn't decide whether you get the pill, it's the doctor.
Right.
And so what the manufacturers are going to say is, we don't know whether our drug is appropriate for a certain type patient, therefore we rely on the doctor to make that decision. And if a doctor gets someone addicted and a doctor gets someone killed, it's the doctor's responsibility, not the manufacturer.
It's tricky. That was the same argument I thought, and they threw that at him on the show. And what he said is, yes, maybe in some cases, but there's this tiny little town, I think in Mississippi, population 200, and there was a pill mill there. And
there was a pill mill in West Virginia. It was on a few years ago.
And he's saying, what you're saying is, don't tell me for a second that these big pharmaceuticals didn't know that 2 million doses of these pills were being sent to this tiny little town in the backwoods of Mississippi, and they were going, he's saying, I'm going to make the case that they knew darn well what they were doing, sending millions of pills to this population 300. What's going on there? Don't tell me you don't know that. If I'm on the jury, pharmaceuticals are going down, and I think that's true of a lot of people that will end up on a jury.
Yeah, the thing that concerns me most about this is not whether the manufacturers go down or the doctors get held accountable, because they should. What I'm concerned about are people who have a legitimate need for pain medication and won't get it.
Right. Well, and that's the thing. I'm not against opioids. We have people that call in and watch the show that are on it, but you know what I mean. It's the prescriptions that people burn through, and the doctor's not even paying attention. And you're right, the doctors are to blame a lot, and they just keep writing them. But you're right. I've already had some folks contact me saying they're frustrated that they can't get the pain pills they legitimately need, and I do feel for those folks.
What was on last night? I thought it was on Channel 5 about the fact that mothers, postpartum mothers, getting opioids after 5 days. Now, doctors know. They're smart enough and educated enough now to know there's a very tight window of time when you use opioids, and beyond that window, you're exposing someone to addiction. Again, I'm no shill for the manufacturer. I'm just telling you, the doctor's there and knows this. All the manufacturer can do is put the pill out there and say either use it or don't. It's up to the doctor to decide when it's appropriate.
I see that, and that's how it's going to have to play out. You and I have talked about this. I mean, we've had injuries. You've been prescribed opioids, haven't you?
Oh yeah.
Me too. I never finished the bottle. I'd toss them.
Well, I finished the bottle.
Did you? I just didn't. I was afraid. Well, darn right they work.
I mean,
how long can
I've had dental implant work, and let me tell you something. I couldn't have gotten through it without opioids. I'm just saying straight up.
So how much is too much, you think? I know you're not a doctor, but I mean, if they gave it to you, I mean, would you want to take it for more than a week or two?
I don't think there's any. Well, no, I don't think there's any pain, serious pain, that's going to last more than about 3 or 4 days. If it does, you need to go back to the doctor. You either got an infection going on, or there's something wrong with the procedure itself.
Yeah.
Most serious pain that's going to require opioids of that kind of quantity, I think you're going to be done within the week.
Yeah.
And that, if you can get it done within the week, the odds of addiction are extremely low, unless you're already an addict.
Point taken. And of course, there are types of chronic pain, back pain and stuff like this, where you have to be on it longer. So let's go to Gary. Hi, Gary. Hey, Gary, good morning.
Good morning.
Hey, how can we help you, buddy?
Yes, back last July I had surgery and the sciatic nerve. and in my left leg, and they put 2 rods and 6 screws in my back, and my left leg stays numb 24/7. My left foot stays cold 24/7, and it never helps. They did it at St. Thomas West, and
sounds like Gary's phone. Let me tell you about sciatic nerve.
Sciatic nerve, okay.
What we don't know from Gary is it how much worse is it from what it was when he went into surgery. A lot of people have it's called sciatica. It's a pain that goes down your leg. It's a numbness, pain, tingling, all that stuff. And they go in there and try to relieve pressure on that nerve. Now, one of the risks of having that surgery when you're having rods and screws put in is you may damage that nerve even further. That's one of the risks that you're supposed to be informed about. The question here I would have for
But there
Gary,
could have been damage to begin with.
Yeah. And did Gary know going into this thing, or was he informed that this could be worse? And that's again hard to tell, but it's real tricky. I think I've talked to you about back surgeries and nerve surgeries. Real tricky kind of stuff, because it's hard to pin down malpractice in those cases, because there's a certain degree of risk going into these surgeries patients have to undertake.
Again, right now, is there some new frontier of malpractice? I mean, types of cases that you're seeing that are coming up now? I mean, we've talked about that whole case of folks stroking out after surgeries because
blood clots.
Blood clots is the biggie.
Blood clots
still
right
the
now
biggie.
Is still the biggest one in my mind, because it is so devastating and it's fatal.
I tell you, I still see a case like that reported somewhere in the country every single week.
You're going to continue to see these cases until the hospitals finally get the processes in place to give people the anticoagulants that they need over the long term. And then when I say long term, I mean up until the time they're discharged, to prevent these clots from forming. I mean, it's that simple.
And you can have a clot form after any time you've been cut on. Is the whole idea.
And particularly, look, any surgery that lasts longer than an hour, that's going to keep you in the bed for any period of time, and particularly if you're above the age of 40 or 50, you are a blood clot risk. You have to have an anticoagulant. And you know those sequential compression devices squeeze your legs to keep the blood flowing, to make sure either clots don't form, or if they do, they don't become dangerous. They can go in your lung and kill you. So yes, that to me is still at the vanguard of medical malpractice litigation. And Nick, and I'll keep talking about this, I'm still seeing battery cases. I'm still seeing wrong patients operated on, or the wrong body part being operated on, or the doctor going beyond the scope of permission that he was given. In other words, the patient consented to a diagnostic test on his leg, the doctor going beyond the diagnostic test and decided, well, I'm just going to go ahead and start fixing the vessels in the leg, and it goes wrong and the patient gets his leg cut off.
Oh.
I've got a case like that right now.
Where the doctor did not say ahead of time, if we go in and find a problem, do you want me to fix it? And here are the risks involved. Instead, they just do it without.
No, he did one-stop shopping, so to speak, and never talked to them. And see, the problem with
that how does a doctor who graduated from medical school know that to do something? Doesn't he realize the risk he's taking to put his neck on the line? That's just dumb.
Because a lot of patients just put up with it, Nick.
Yeah.
He probably thinks he's doing the patient a favor.
Maybe.
We used to call it paternalistic medicine, where he says, oh, my judgment's better than yours. I'll go ahead and get it done right now in one procedure and you'll be fine. That's all fine and dandy if everything works out, but if the thing goes south and you never told the patient what the risks are, and he wakes up and finds out he's going to get his leg cut off, that's a problem.
You're so right. Hey, they will know better, medically speaking, but I need to know the risks so I can weigh whether it's worth him going ahead and doing that.
Because you and I both all of us have the right to control our bodies. We have the right to decide what procedures, if we're competent, and it's not an emergency, what procedures are going to be done on us. And if a doctor's going to go beyond what you have agreed or consented to, you have to be told in advance and given the opportunity to accept or reject that recommendation. Otherwise, what we call a battery has occurred, a medical battery, and it can cause a pretty big lawsuit.
Man, and then again, the infections in the hospitals. We've had a few calls on that. You know, Alex Smith, quarterback of the Redskins, suffered a compound fracture when he was tackled during the game. Now, I know compound fractures, that's where the bone comes through the skin.
They're nasty.
Well, he just got out of the hospital because they did all that surgery, and then it had a bad infection he had to deal with as well. And this is an NFL quarterback that I'm sure is getting the very best possible care, I would imagine, you could possibly get. And he still got an infection.
Do you know who Matthew Perry is on Friends?
Yeah, sure.
We just found out not too long ago, Matthew Perry was in the hospital for over 90 days. He had a gastrointestinal procedure, developed a leak, got an infection, and he was constantly dealing with infections. Couldn't get out of the hospital, couldn't stay out of the hospital. It almost killed him. And Alex Smith, there was some concern whether he'd keep his leg.
Yeah.
Those compound fractures.
Yeah, because they open the skin,
and
right?
there's something else called compartment syndrome where blood leaks out. It can cause a lack of blood flow, and again can lead to amputation. But your point is well taken. Infections are part and parcel of going to the hospital, and if you get the infection, that's not really where you can hold the hospital accountable. If they fail to diagnose it and treat it, that's where you hold them accountable.
Standard of care. Bottom line, sometimes you can't avoid it, but what I've learned from this man is you do everything you possibly can to never be admitted to the hospital.
Stay out of the hospital.
And sure as heck, if you can avoid it, avoid any kind of surgery. That should go without saying. But if there are any alternatives, don't let them cut you open, because it allows all kinds of things to get in, right?
It's full of bugs. It's full of sick people. That's what happens. You know, sick people go somewhere, it's going to be full.
How come the doctors and nurses don't all get sick? They're around them all the time.
They do.
Okay.
They get sick.
Yeah.
I mean, you know, but they're not being cut open.
Yeah.
It's one thing to get bacteria on your skin, you can wash it off, or maybe you get it in your nose or whatever. It's another thing when staph gets into the bloodstream.
Yeah.
All bets are off when that happens.
All bets are off. Clint, you are awesome. Listen, thank you for coming on.
Yeah, Merry Christmas again.
Merry Christmas, Happy New Year. We'll see you in January,
That's
right? Get it going there. And listen, as we break, and again, I look forward to seeing you. Thanks. It's good to see you, my friend. We'll have his contact information for you, the numbers and where you can reach him right after this.
Remember,
Stay with
Nick,
us.
the call's free.
Call is free. I'll remind him of that. Thanks, We'll be right back.